This required doc checklist is, well, here's how it's organized. I have order of importance. You do need all of these items. You do. But as far as what information is the most important to get right and make sure it's accurate, this is exactly what I would say. It's employee plus dependent census. Why? Well, because the health insurance is based off of that risk. All right. So in here, we have the required documents, description, the document format, the possible location. And as you go on, there's like locations like, payroll reports. There's, employee and benefits, employee independent census download. There's a few areas you can get that stuff. So that's what that is. But for our clients, like employee independent census. Well, why is that important? On this data is required for medical insurance. It has the salaries in there. It helps you figure out the workers' comp. It helps you figure out the zip codes they work in. Super important for workers' comp. It also helps you figure out what zip codes do the employees live in. Well, what about their kids? Where do they live, right? We want to map out the carrier networks and make sure that we're not only giving you plans that make sense, but make sure that we're giving you plans that make sense based off of your group and where they are. So that's why that piece is super important. And look, having it in an Excel format versus a PDF versus printed copy makes a world of difference for the people who are evaluating this stuff for you, right? So I highly encourage you, if you can, get this in Excel format. For the medical billing statement with employee details, this is an invoice that you get every month. If you're not on a PEO, you're probably familiar with it, right? It comes from your carrier. It'll also have like the amount of premiums you need for the month or that you owe. That's your billing statement. It also has the employees, who's enrolled in what. If that same carrier has like medical, dental, vision, all those different items, it'll be in there. The most important and why it says medical billing statement is because that's the most important piece that the PEOs are going to want to see. And it's the main thing that they need. For the ancillary services, it's not as important. It's important for your comparison. You want to know, like, hey, what's the difference between their dental plan, our dental plan, their life plan versus ours? But as far as pricing is concerned in this first pass, medical is the most important piece. So you're going to want to give them that invoice in a PDF format. That's what's preferred. Why? Well, because you could manipulate the data and put like, hey, our premium is only $100 per employee per month, right? So if you're on a PEO, what do? If you're on a PEO, you're probably not getting the invoice directly from the carrier. You're getting it from your PEO provider. So generally they accept like a benefits deduction report. They'll accept an Excel format, right? Because it's a report, but they also want to get an invoice from your PEO that shows the total amount you were billed for that period. Why? Well, because that's what's going to tell them, do the numbers tie out, right? So in some way, shape, or form, they want to know hard copy evidence, PDF. Where are you getting these numbers from? And is this actually what you're getting billed so that we can make the right assessment? Okay. Summary of benefits coverage. I mean, that is that 12-page document you see that has like, it's like white, blue, every carrier provides it. It's pretty standard. It has your copays, your deductibles, it has your formularies on there. You have links to go to the carrier website, some of the employees' rights. And it generally is a PDF that has those little things in there where it says, like, here's an example. If Jane goes to the doctor and she breaks her leg, what's her copay? What is her deductible? If she stayed overnight in the hospital, how much did that cost? And they do that based off of the plan that you're looking at. So you'll typically see that in page like 10, 11, maybe 12 or the last page, depending on the footnotes. But that's where you typically, that's what the type of document it is. The format is always PDF, and you'll typically find that in your Ben admin system. Sometimes it's in your open enrollment paperwork. It can be on the carrier's website, or if you're using the plan that's used, statewide, then it could be, online. If it's with the PEO, you should have access to that, especially if you're an administrator. You generally go into benefits administration, carriers, and then go into carrier plans. And you may, if the PEO does have like, dozens and dozens of plans, you may need to find the plan name and share that, right? Okay, so medical renewal. If you're within 90 days of the renewal date, so in this scenario that we went through, January 1st, the PEO is going to want to know, hey, have you gotten your renewal yet? Right? The carrier has to release it by 60 days. So certainly if you're in that 60-day window, they're going to ask for it. Why? Well, they're going to ask for it, and the format that they want it is PDF. But again, Excel is acceptable if it's coming from, like, say, your broker and there's a comparison, all that. But it's a letter that you get, and typically it's the rate increase for the upcoming plan year. That's what they want to know. Because if they look at your risk profile and then all of a sudden they see you jumped up 27%. Well, why did you jump up 27%? Because this plan design that you have does not the premium does not cover the type of losses that you have. So if you're on a plan and you're in small group and we don't have access to how you utilize the plan, that's really when it's like very important for you to have your broker involved, your insurance broker. And if they don't know PEO and they're not something they're comfortable with, or they say I don't like PEOs or work with them, then that's when it's time to get a little bit creative in terms of, do I want to work with this broker still or not, right? Because any broker that is out there in these days, I feel like should at least be aware of PEO, understand the value of it, and not try to steer you from it because it makes sense for them to steer you from it. They should want to explore this and see how they can be helpful. And most will, but not everybody knows exactly how. So when you have this medical renewal, it's going to come in PDF. Some PEOs will accept the Excel version of it. Some will. And look, and that's generally if your PEO provider doesn't give you a PDF version of it. If you're working directly with the carrier, generally they want a PDF version. But if you're working with the PEO, they have to start accepting reports, because the PEOs don't give you their master plan or the plan design with hundreds of thousands of people on it, what that renewal is going to be. Right? Everybody, like, it's a little bit different. So if you're in that 60 to 90-day window, you might be able to get away with pushing back and saying, hey, can we just get a quote anyhow? But certainly by 60 days, if you haven't positioned yourself to make a decision, then you're going to have to provide it. And it's likely that your quote will go up, or the PEO may just quote you and assume a rate increase of X percentage. Okay, next one. Our current PEO invoice details. Okay, so this is like the monthly per payroll invoice that you get, and it details the gross wages all the way down to the net. It has the benefits, the workers' comp, the employer taxes, the employee taxes, everything that debits down to, okay, what net pay came out and what was the total amount that was taken from your bank account, ACH. It should all tie together. The reason why the current PEO invoice details are super important is it helps somebody who's evaluating this, especially if it's another PEO to PEO, right? Does this tie back to what you said you were getting billed for your insurance, specifically like the health benefits, right? The PEO invoice will have a total number, and that total number should match back to this number up here. Now, what's the difference? Did you add an employee? Did you subtract one? Did one go on COBRA? What happened here? That's when you're going to start getting those underwriting questions or risk assessment questions. And you want that. Any PEO who goes through the process and doesn't ask you detailed questions, which they're looking to just put as many lives as they can. And that strategy doesn't last long term. We've seen it time and time again where somebody will load a bunch of people on their PEO. They get a great rate from the carrier, but then all of a sudden, oops, premiums versus the losses, it really messes up the claim ratio, right? So that leads me to the group health questionnaire. Not every PEO asks for this. Most do. Most of the reputable ones do. And this is something that generally, they have some general questions. And the reason why we leave the general health questionnaire out of it at this point is mostly because depending on which PEO we go, our clients, they may get different questions from different carriers, which means the PEOs may give them, a different checklist. If it's, say, Insperity, they're very thorough, right? They want to know a lot of things. And when you're looking at this, it typically comes in a PDF, or it may come in DocuSign, and generally you have to sign it or have somebody who's authorized at the company to sign off on it. And you want to complete, again, right here it says to be completed to the best of the insured's knowledge. Well, that is very important to note. Why? Because for PHI for HIPAA reasons, you can't go around asking people, are they, hey, like, are you using, this specific, drug, or hey, why is your utilization so high? That's not for you to know, and you shouldn't have that information. So you shouldn't go around asking people. However, you want to fill it out to the best of your ability. In an example I had with one client where, we shared with them, hey, you got to have this GHQ filled out, and they were actually pregnant, and they said that there was no pregnancies. They were 6 months pregnant, and they knew that they were going to have someone, or they were going to have give birth, and they put that no one was pregnant. There's no reported pregnancies. So it's in a way like they purposely omitted the information in order to get a better rate potentially, because they thought it might impact them, right? So the PEO will be able to come back and say, hey, maybe we need to re-rate this group if it's that offset. Now, it doesn't happen all the time, and generally they're pretty lenient, but you want to be as thorough as possible, because this is why you end up getting a high renewal, or this is why some companies see like 26% spikes in their carrier invoice the next year on the PEO. It's because you weren't forthright, you weren't honest, you didn't give them the information so that they can make a good business financial decision on how to price you. And that's how you have a better budget. You don't want surprises coming to you 90 days before. Hey, even sometimes 60 days before. Hey, surprise, for the exact same thing that you had this year, or worse, or maybe slightly better, we're going to charge you another $200,000. I mean, that's a lot, right? And that can devastate some folks. Payroll details. Right? The payroll details journal with deductions is a very helpful report. In fact, it's something I would say is a great source document. Why? Because it will outline all the benefits. Sometimes it's hard to remember if you have a very comprehensive benefit package. What are we actually giving to people? And if it's a benefit that has anything to do with your total reward statement, this will really help you out in the process figuring out, is my total reward statement increasing because of this change, or is it decreasing? If so, where, and where do I need to make a change or a decision? Which then goes into your open enrollment strategy, which then goes into your communication plan, which goes into a lot of the things that we need to use somewhere down the line. So that's why it's very important. Benefits register. This shows you exactly who's enrolled and who's not enrolled, right? And you want to get the benefits register where they have the employee and the dependent information, because that does help you not only confirm their census data, but the amount of premiums that you cover as an employer, what they're putting in as an employee, which lines of coverage, why they're waived, the reasons. Because when you are looking at the PEO, they're going to want to know what your participation levels are. They're also going to want to know, hey, why are people not actually enrolling in your plans? So we had a case recently where somebody was less than 50%. They dipped below that number. 33% of the employees were using the medical benefits. So now you go to the PEO, and the PEO says, hey, we need to have at least 50% participation for this to make sense, right? And stay in compliance. Well, we were able to make the case, because the waive reasons on all of those employees unanimously were, it's too expensive, can't afford it. These are people who are making $45,000 a year and having to pay $400 a month for employee-only plans. And these are a lot of people with families, meaning that the price was double, maybe even triple what that would be as far as a contribution. So they were coming to the PEO specifically to leverage their buying power, get better benefit options, become an employer of choice. And that is the reason why they came to the PEO. And when we can share that story with the vendors, that's when we start to be able to get their support in figuring out how can we give them the best opportunity to accomplish this. Because at the end of the day, that's what the PEOs are all about. And again, that's why you need to do the benefits register. So PDF is acceptable, but in this case, I would say Excel or CSV is preferred, right? And you would find that either in your PEO, your HRIS, your payroll, your admin journal, our admin portal. That's really where you want to go to for this information. You can typically download it. If you do have workers' comp and it's over, well, every PEO is going to be a little bit different. But if you're like a software company, workers' comp is almost like a pass-through. If you had some losses, you'll definitely want to share it, because you're either going to have to sign off that, hey, we've had no losses, or you're going to have to provide a loss run report of 4 years, or some companies that haven't been around 4 years, just hey, back to the end of time. And usually you'll get this in a PDF version. Sometimes Excel is acceptable depending on how it was downloaded. But you would get this either from your PEO provider. You usually have to request it, or you'll have to get this from your carrier admin portal, right? Or you may have to get this from your broker if you don't know how to do that. Now, a lot of people tell me, hey, I don't want to get this information because, I don't want my broker to know that I'm shopping and looking at other items. Completely understand that. That makes sense. If that's a point of contention for you, sometimes you want to ask the sales team, hey, is there anything I can do to get a quote, at least for the benefits piece? How important is the workers' comp in terms of like pricing? And sometimes they can work around it because they run into that problem quite often. Now, I'm not going to say that you should omit that information. And the reason why we say optional is a lot of times our clients will get exceptions for that, especially if we're not actually doing the workers' comp for them. I mean, if I'm ever in that situation as a broker, I would want to know, hey, how can I be helpful in this situation? What information do you need? How can we get it to you as quickly as possible? Do you want to connect me with these folks? Like, what's the best thing to do? Because ultimately, it's your company, it's your plan. You gotta like work with people that you enjoy working with. And if you're looking at other options, then you have to just do the right thing. So don't be afraid to ask for it. But if it is a point of contention for you, then yeah, there might be some workarounds, specifically for workers' comp. Okay. And again, PDF is preferred, but sometimes Excel is acceptable depending on the format. Now, company info.